life, every day, late at night, not okay.
Hi everybody and welcome to our Facebook Live, How to Approach Problems with Your Coverage. My name's Mia McFarland. I'm with the Pacific Islander Health Board, and with me today is the rest of our team. And I'll have them, actually I'll stop share. Yeah, we'll go ahead and introduce each other. I'll start with who I see first, Clara. You're on mute.
Hello again, I'm Clara. I'm from YAP, YAP's Navigator. Thank you.
Thank you. And then I see Roz next.
Half a day, Ross Leon Guerrero with the Healthcare Authority in the Office of Medkit Eligibility Policy. I am the COFA Islander Programs Manager.
Awesome. Thank you. And then Ariel.
Thank you, Mia. Ariel Pertek with the Healthcare Authority. I work with Roz in Medicaid eligibility policy.
All right. Thank you. And then Alinda.
Hi, my name is Alinda Yawalang Rumajaro. I am working with Pacific Islander Health Board, and I am also a COFA navigator and a community navigator from Mall.
Awesome.
Thank you.
Thank you. All right. Just like last time, we're going to get started with a little bit of trivia based on the last time we were able to get together. So today's trivia will be based on our last presentation. You qualify for Apple Health. What's next? So comment your answer for a chance to win a special prize. And the first person to answer correctly wins. And today's special prize is going to be COFA Islander Programs lanyard that we're going to mail from our office that we'll have. Yay, exciting. So the first trivia question for folks joining in is, how many managed care plans are there for Washington Apple Health? We'll just give people a second to answer. And while we're waiting for answers to come in, we could talk about how to see the presentations from the last couple times. So there's a couple ways. And the easiest way is to go onto our Facebook or our YouTube and look for the videos. One was 2 weeks ago. And then the other way will be that the presentations will be on our website, and I'll show everybody how to get there in just a second. Oh man. Okay, does it count if someone from our team answers correctly? I'm getting kind of a no from Clara. Clara, what do you think? Oh, you're on mute.
Again, maybe we should give the rest of the people a chance to answer.
Okay, you heard it. The rest of the people. You still have a chance to answer.
Maybe if nobody answers, then we go back to whoever answered.
Good point. Okay. Somebody got on and said, no, it doesn't count if someone from our team answers correctly. All right, Gerard, if you know the answer, though, it could be yours. Somebody who's using our page guessed 6. That's close, but it's not right. I love it. We're so close. It's close to 6. IDK. No, it's fair. Oh, we got another answer. 8. Okay, it's a little too high.
I have a comment.
Yeah.
Are they writing down all the names of the plan? That will be a bonus.
They just need to know how many there are. They don't have to know the names of all of them.
Oh, okay.
It'd be cool if they did know all the names, though.
Yeah, since everybody know that how many of them, I think that will be a bonus if they put the names.
Yeah. Free lunch if you know all the names. Hi, Janet. Welcome. All right. Gerard said 7. Still too high. We got to go lower. You guys are so close. It's lower than 6. That's the hint. So I just thought I'd try. No, wait. See, that's good. It's a good. And then now you know what we'll do next time is we'll go ahead and do the same thing where everything that we talk about today, we'll do a couple trivia questions out of today's presentation the next time we get on Facebook Live. Okay, we got some 4s. So close. I mean, I guess depending on what region you live in, there could be 4. That's a good point. All right. Any last guesses? I think we'll... I love the just guessing now. I love it. Nobody got this one. But the answer was, unfortunately, it was Lika who put it in. The answer is 5. There's 5 managed care plans. And so you can see on here that there's AmeriGroup, Coordinated Care, Community Health Plan of Washington, Molina, and United Healthcare. And like I was saying, depending on what region you live in, there might be 4 that are there. Some of them have 5. It just kind of depends on who's working there. Like if you live in the Tri-Cities, you only have 4. Same with like over in Spokane or the Southwest. But 5 are available throughout the state. Man, that was a good one. All right. The next trivia question is, how do you find a doctor that takes your insurance? I didn't move my head. I'm using 2 screens. So we went over this last time. There's a really easy way to find a doctor. But while we're waiting, any words of wisdom from the group? Someone said, so everybody's going to get a lanyard. That's true. If you do come out to our enrollment events or education events that we're going to do in person, we do give out lanyards. So incentive to come, and pens and the magnets that go on your fridge, which are really great for hanging up like your kids' report cards and stuff. All right, we got a couple answers. We got Google. Like that is, you could find a provider that way. That's not a way that we went over last time. And then we've got Ask Amazon Alexa. I'm gonna go try that now. And then we got, you ask the healthcare provider online. Huh. I mean, you could. That is possibly see if they check your plan. Man. Any other guesses? Ask Siri. You could ask Siri. But there was one way that we went over last time that I'm looking for. All right. No more guesses? Man, tough cookies. Good trivia though. All right. The correct. Oh, yay. Yes. That's exactly right, Alana. Call your insurance. You're right on it. You can have a lanyard. Okay. So that's exactly right. So you can call the number. Oh, Janet, you got it too. Yeah. Talk to your insurance. Very true. So on the back of your insurance card, and we'll show everybody later on in the presentation what the insurance card looks like. But that's a really great way is to call the phone number on the back of your card and that should be similar to the numbers on here. So these are the contact numbers. We'll go over this a couple times. The contact numbers for the different health plans, depending on who you have, you would just give them a call and ask them to help you look for what you're looking for and who will take your insurance. All right. Thank you, everybody, for playing. That was very entertaining. But pay attention, because next time we'll do it again. Okay. So we'll do the quick agenda here. So we just went through our trivia. We'll do it again next time. So make sure you pay attention today. Some other items, we'll go over some tax information for folks because taxes are due, the filing for your taxes due in April. We'll talk about a little bit reviewing what is Apple Health, go through some issues like the Washington Health Plan Finder, username and password, how to update your information in the Health Plan Finder, how to provide additional information needed by the Washington Health Benefit Exchange, what happens if you didn't receive or you lost your health plan cards, the transition from COFA Health to Apple Health, what to do if you receive a medical bill, how to find a provider, and who to contact with your concerns. So we'll have contact information for a lot of folks. Then we'll go through our survey and, of course, our questions and answers. So if you have any questions, please put them in the chat throughout the presentation, and we'll make sure to answer them. All right, so the tax information, this is what I was talking about. So when you're filing taxes, you should wait, especially if you've gone through the Health Plan Finder, wait to file your taxes until you have your 1095A form. So the Health Plan Finder mails that form to you at the beginning of the year. When you get tax credits, you can't file your taxes without this information. So please wait for it. If you haven't received it, the easy way to replace it is go on to washingtonhealthplanfinder.org, and you'll be able to find it in the Document Center, or you can call 1-855-923-4633. And so you'll use the form 1095A to complete IRS form 8962 and attach it to your 1040. And then here's some free tax filing resources. I know the United Way helps, along with the Volunteer Income Tax Assistance Program. There's a Clear Hotline, or online at irs.gov. They have free filing resources for everybody, just in case, because it can get complicated. Okay, I'm going to go ahead and pass it over to Alinda.
Okay. What is Washington Apple or Medkit? Apple provides care to over 2 million Washington residents, including pregnant individuals, children, and adults. Apple provides medical, vision, dental, benefits, and healthcare services, such as preventative care, cancer screenings, treatment for diabetes and high blood pressure, and many other health care services. There are no co-payments, deductibles, or other out-of-pocket expenses.
Thank you. And then I'm going to pass it to Renza.
Hi, everyone. What does Apple Health cover? Appointment with a doctor or healthcare professional for necessary care. Medicare in emergency, maternity and newborn care, mental health services, treatment for chemical or alcohol dependence. Sorry, tried to catch my breath. Pediatric services including dental and vision care, limited dental and vision care for adults, prescriptions, medication, laboratory services, hospitalization, transportation to and from medical appointments when necessary, an interpreter for your appointment if you do not speak English, arrange to your provider, COVID testing and vaccination. Apple Health requirements. An application is required to determine if an individual is eligible for Apple Health Medicaid. COFA islanders must meet all eligibility criteria for Apple Health, including income limits, social security number requirements, proof of immigration paperwork, and Washington residency. Classic Apple Health. Classic Apple Health refers to programs administered by Department of Social and Health Services, which is DSHs. Individuals who are age 65 years and older, have blindness or disability, or need long-term services and support. Apply for health coverage online at washingtonconnection.org or call DSHs or submit a paper application. Eligibility criteria varies for each program and is based on household size, income, and resources. If you forgot your W Health Planner or user or password, call to whealthplanfinder.org, sign in, click either forgot username or forgot password. If you have forgotten both, make sure to click forgot username first.
All right, Alinda, pass it to you.
Okay, sorry. If you forgot your username and you have a problem getting to it, then you need to go to Washington L Plan Finder. And first of all, you're going to have to put your email right there in this box, and then press next. And if you forgot your password, you need to put in that box under where it says enter your username. To reset your password, you'll put your username right here. This is for you to change your password, to get your password. And if you do not remember the email that you use, don't forget that you need to call the Washington L Plan Finder Customer Support Center at 1-855-923-4633 if you still cannot log in. And if you do not have a Washington L Plan Finder account, call the Washington L Plan Finder at 855-923-4633. Let them know you need help creating a username and password for your account. And in the dashboard, you will manage your coverage option. You can view these matches and upload account setting. You can go to the matches center up there and create application.
You got it right on the head. And then this is where you'll report a change too. But this is just what the dashboard looks like. Thanks, Linda.
Oh yeah, you can report a change. Press report a change. Sorry about that.
You got it. You were right on it. All right. Then I'll pass it to Clara. You're on mute.
How do I update my information? You have to sign into your account, go to your dashboard and select report a change. Select the change you want to report on the report your changes screen. How do I update income? Sorry. Sign into your account again. Go to your dashboard, select report a change. Click yes to the statement. My household income has changed by 150 or more, and it's expected to last at least 2 consecutive months. Update your income and e-sign your application. You receive a letter requesting additional information. If a letter is mailed from Washington Health Plan Finder, verification can be provided by uploading the HPF account and document center. You can mail it or email and fax. For questions on request for HPF pertaining to Apple Health only, call the Health Care Authority Medical Assistant Customer Service Center at 1-800-562-3022, or you can call Pacific Islander Health Board Navigator at 1-888-308-7113. Don't receive or lose My Provider One service card. There are several ways to request a replacement. Visit the Provider One client portal website at www.washingtonproviderone.org/client or call 1-800-562-3022. Follow the prompts. Request a change online. Select the topic service card. There is no charge for a new card. It takes 7 to 10 days to get the new card in the mail. Your old card will stop working when you ask for a new one. Don't receive or lose My Managed Care card. Call your managed care program to replace your card. Ameri Washington, Community Health Plan of Washington, Coordinated Care of Washington, Molina Healthcare of Washington, and United Healthcare Community Plan. Health Plan Card. A few weeks after you enroll in Apple Health, you will receive a Health Plan ID card as well as more information from your plan about how to choose a doctor or primary care provider.
Thank you, Clara. And these were the cards I mentioned earlier that on the back will have a phone number that you can call to find that provider too. So if you have that card, on the back of it is a lot of information you can use. All right. And just to go over the transition to Apple Health briefly. So the transition from COFA Islander Healthcare to Apple Health occurred in July 2021. Individuals enrolled in COFA Islander Healthcare who are under 65 and without Medicare transitioned to Apple Health as of July 1st, 2021. Their COFA Islander programs and qualified health plans ended June 30th, 2021, so there's no gap in coverage. Individuals age 65 and older or have Medicare must apply for Washington Apple Health via Washington Connection, so that's through DSHS. Their COFA Islander programs continued through 2021 to ensure there was no gap in coverage while they applied through the Department of Social and Health Services. And so there's some folks still on COFA Islander care, but if you are under the age of 65, you've transitioned to Apple Health, which means you got some new cards. And so what does that mean? You should no longer be using your COFA Healthcare cost sharing card, the Navigator Card, or COFA card. And so these cards, you're unable to use them anymore. So make sure that when you're using cards, it's your Provider One card and your Managed Care card that you should have received in the mail. But if you haven't, you can give us a call and we can help you figure that one out. All right. And then one more issue, if you've received a medical bill, when doctors and other providers work with Apple Health, they agree to take what Apple Health pays and not bill you for any difference. So your first step should be call your hospital or your provider to double check that they actually billed your insurance. If you receive a bill, call your managed care plan and then HCA immediately. We'll have the numbers later on. And you can't be billed for an Apple Health covered service. So if it was one of the covered services we listed above earlier in this presentation, you should never receive a bill for it. All right. And then revisiting how to find a provider. I know this was in the trivia. So to choose a primary care provider, follow the directions sent to you by your health plan or call your health plan's member services phone number on the back of the card. You can also choose a primary care provider through your health plan's website, and make sure you call that number on the back of your card. If you don't choose a primary care provider, the health plan will select one for you, and they'll let you know about that. And then these are all those phone numbers again for AmeriGroup, Community Health Plan of Washington, Coordinated Care, Molina, and United Healthcare Community Plan. So if you don't have that written down or you don't have your card, here's where you can write that down. And then for the Healthcare Authority, contact or questions, concerns, or requesting an appeal. So like if you have Medicaid eligibility and you have questions, if you want to do a post-eligibility case review or reporting changes, do your Apple Health for Kids premium payment, or request an appeal for Apple Health programs, this is the contact. So you could go online through their website. You can email askmagi@hca.wa.gov. You can call this phone number 1-800-562-3022. And there looks like they're available Monday to Friday, 8 to 5, except for state holidays. And then for DSHS, if you have any questions, concerns, or you want to request an appeal, this is classic Apple Health. We've said that before. So if you want to apply for Medicaid, Medicare savings, Social Security, any for 65 plus and disabled programs, or if you want to request an appeal for classic Medicaid, you would go ahead and call DSHS at 1-877-501-2233. You can call 711. And then their business hours are Monday to Friday, 8 to 5. You can do it online at washingtonconnection.org. And also, all of their in-person locations should be open now. So if you want to go in person and meet with them, you're able to do that now. All right. And then the last slide here is you receive a letter in the mail from Washington Health Plan Finder, but you don't understand it. So there's a couple different things you could do. You can call a PIHB Navigator at 888-308-7113 and go ahead and ask us that question. You can call the Washington Healthcare Authority helpline at 1-800-562-3022 or the COFA line at 800-574-3109. And I know Roz is going to be picking that line up. And then you could also call the Washington Health Plan Finder, who should be sending that letter. They have a support line at 1-855-923-4633. And that'd be the same phone number you would call for other issues too regarding your application. All right, I'm going to pause it here for a second. We have a survey of this event and previous events if you'd like to let us know how we're doing. It takes less than 2 minutes. I promise. I'm going to make sure this link gets into our comments. Oh, where did we go? And then, so if you want to click the link in the comments as well, it'll be there. Otherwise, we'll open it up to some questions. So if you have any questions, please pop them in the chat. Not the chat, and then I'm going to share this presentation link. I'm also going to play the music again. All right. We'll wait for some questions. Do we have any questions while we're waiting from our team? Or questions that people have asked you that you have answers for? Anybody? Let's see if there's any good ones. No questions yet.
I got a quick question about the cards that you were showing it.
Yeah.
So you said those cards, whoever got those cards, they can use them no more?
Yeah, you can't. So if you know you've been moved to Washington Apple Health, let me go back to that slide. So I'll fix this. So if you are under the age 25 and without Medicare, you should have transitioned to Apple Health for Adults as of July 1st, 2021. So if you fall in that category, you can't use these cards anymore.
The Navia card was used to pay any co-payments or any expenses that you had at the doctor's office. But now that you had now if they had transitioned to Apple Health Medicaid, they should receive the Provider One Services card and their health plan card. So the Navia card has ended. They don't use the Navia card.
Thank you.
Yeah, that was a good question because we've been to events where people like still have these cards and are wondering why they don't work. Yeah. So that's why.
Absolutely. And a lot of people have been calling in like, my Navia card's not working. How do I get my prescriptions? My Navia card's not working. I have a co-payment. So yeah, the one thing you want to do is verify if they are in Apple Health. When people call you, verify if they're in Apple Health. And then ask them, have you received these cards?
True. All right, folks, let us know if you have any questions.
I don't have a question, maybe later, but I just want to remind everyone that there's like materials for all these events. They're recorded and they will be sharing it. And yeah, is it okay if I talk in Marshallese just to let all the Marshallese?
Yeah.
Yeah, ya kung level remaja. Jab ini pada apa eleng jad men kemengan recorder ikichen oleh ben live again. Kitchen kajen maja oleh ben live golak ikan Apple Health. Ni mo oleh parray ni. Kami minute ya share elo media. Pokon belele. Mall. That's it.
Thank you. All right. Someone asked, are the COFA Islander cards still working? So if you've transitioned to Apple Health, no, they don't work anymore. But if you're not sure, we can also verify that for you if you give us a call at 1-888-308-7113. And we can double check if you're on COFA or Apple Health. All right. Any more questions? Maybe this presentation was just that good.
No, I think everybody understand and they get all the facts that we shared.
See, we did too well. Oh my gosh. All right. Well, good time to remind you to take the survey if you're just hanging out watching. Or if you have any questions. Oh. Thank you. Yeah, I did have very good information. Yeah. We've been trying to listen to what community has to say and what concerns have been coming up. Like, I would probably, what I love is that I would probably lose my card all the time. Because I do lose my insurance card all the time. So it's good to have that number handy.
And they can look you up through Provider One portal, right? If you have your Provider One portal, they can look you up.
That's true. We did touch on that a little bit last time.
There are some folks that I spoke to earlier this week that said they didn't have the Provider One Services card when they went to pick up their prescriptions, or they didn't have it, when they went to the ER, but they were able to find them their Provider One number. So, if you don't have it, you let them know that you have Apple Health. You have Apple Health Medicaid, and they'll look you up.
It's great information.
Yeah, there are lots of also from my community, and they always ask about when their card is going to come in. It takes more than 2 weeks, like the provider card and also the Apple Health card. It takes like 2 months for them to receive, and
And
we,
I
we
think,
yeah.
yeah, no, it's true. It's true. And I think what you all could share and what people should know is that they're so those that were in the COFA Islander programs, they're so used to the Navia card. They're looking for that card coming in the mail. So we have to explain to them, and maybe that could be one that we could put up on the website is these are the cards that you should have. Yeah.
Yeah, and put out the numbers so that every time I get called for requesting cards, and I always have to look for like their plan and then call them for them. Some people they don't know how to speak English, and we have to help them out too. Yeah, and they also have to you know get to know how to call up. And I wonder if there's translation. Is there any translation? Like in languages, like if they call up the plan and can they help them with languages?
Are you talking about the managed care plans? They
Yes.
should, yes, they should provide interpretive services. That
Oh,
would,
okay.
yes.
That's good.
hmm and this is also good for other Pacific Islander communities,
Yes.
right?
Mm-hmm.
Some
I
folk,
love it.
like, I know that you all are getting calls because I'm getting calls too as we post this up and we share it on the different Pacific Islander Facebook groups. A lot of people have been calling in like, I'm not COFA. I'm not part of COFA, but I do have Apple Health and I don't have that card. And
Yeah.
they often they're referencing or they refer to the Navia card. So I have to explain to them that the Navia cards is, for folks that are in the COFA Islander programs. But because they have Apple Health, I would verify if they do have Apple Health, and I will ask them, do you have your Provider One Services card, and do you have your health plan card?
Mhm.
Yeah.
That's a good point. Okay, there is a question. This is actually a really good question.
hmm
All right. So I do have United Healthcare. I live here in Silver Lake. My question is, no dental clinics like these government insurances. Can you comment on that? God, yeah. I think my thought is that that is true. It is quite a bit harder to find insurance that'll take Apple, or like the dentist that can take Apple Health. That's true. And I'm wondering, Roz, off the record, you have thoughts about that? But it is hard. I agree.
It is hard, and we often, and everything is on the record. Yeah. But we often just have people refer to the provider listing on the HCA Apple Health provider list on the website that has a dental provider listing. Um, but I know it can be a challenge to find a dentist that does offer dental care, dental clinics. I know that I think it's, is it Seymour Health Clinic? They offer dental, and most people that I've spoken to earlier this week, have shared that they're the only ones that have taken them in. But on the website, and what we could do is I'll pull it up and see how we can get. I'll put up a link, and maybe you can share it as well on providers that accept Apple Health.
Yeah, definitely.
I have question. They sent it to my phone over here.
Okay.
They're asking about dental. Um, for adults, what does that mean? Limited dental care for adults. Are they getting some that just some services that are required?
Yeah, like it wouldn't cover everything. Um,
Okay.
and I think that's a good question.
Yeah, it's good for them to know
Mhm.
because they think that they're getting Tendal when we explain on live. They think that they can get all these services like for the
Yeah.
free Atlantic and all that. Okay, I'll explain to them. Thank you.
Alinda, on the on the HCA website, on Apple Health benefits and services, they do have right. Thanks, Mia. They do have what is covered under dental services.
So yeah, so for adults it's 21 years and older. And then for children it covers up to 20 and younger. So that's something to note too. But that would cover routine exams, cleanings, x-rays, fillings, fluoride application, extractions, nitrous oxide, and then some other limited, so like gum disease, root canals, dentures, oral surgery. And then here's some items not covered. So bridges, crowns, implants, orthodontia. But yeah, so we'll make sure that gets added too. This is a really great list.
Yeah, it's really good to know because these adults they don't speak English and they don't know. It's really
Yeah.
good to translate it and it'll be really helpful. Thank you.
Point. All
But
right.
for children, it's free. It covers everything, correct?
So the dental services for children, so that would be age 20 and younger, would cover routine exams, cleanings, x-rays, sealants, fillings, crowns, fluoride, application extractions, and then orthodontic services with serious dental problems. So it's
So
medically necessary. Yeah.
yeah, and so here, this list is not the full list. These are just some of the items that are covered with Apple Health Dental. Um, for dental, we know that more things are covered for kids than adults. And the best way to find a dentist that takes Apple Health is to call them and ask. And when you see an Apple Health dentist, the items that are covered by Apple Health are free. There's no cost. So it's just getting those items, maybe I'm going to use a crown for an adult. That is something that you would have to pay for.
Awesome. All right. It's good questions because we'll make sure to add that to the resource list on our website. Maybe I'll just even, while we're waiting for more questions to come in, we can go over what the resource guide looks like right now. So we've added some items and I'll make it a little bit bigger. All right. So we've got a couple of things on here. So we've got the presentations we've been doing. So what is Washington Apple Health? You qualify for Apple Health, what's next, and how to approach problems. Those are all on here now if you want to go back and just look at the presentation. And then earlier on, I mentioned that these Facebook Lives will be also on our page and then our YouTube channel. And then this is the contact information for our whole team, depending on who you would like to call, or you can even email. Where to apply for Washington Apple Health, where to apply for individuals that are age 65 older, blind or disabled through DSHS, the lost or not received provider one card, lost or not received managed care plan. And then one thing we added on, we might have to fix that, is the value added benefits of each managed care plan. So that'll talk about like if there's additional benefits. And I know we talked about that a little bit last time. Let's see if we can bring it up. There we go. So you can see like what's available. Some of them have like free cell phones. That's something we talked about last time as well. But that's also on our website to take a look at if you would like a little bit more help choosing a plan or if you had any additional questions. And so that's at pihealthboard.org/COFA-Islander-outreach-information. I'll put that in the chat. And we'll add the dental items now too. So that's always growing based on what we hear. We add on as much information as is needed by community. All right. Any more questions in the chat? Or any more questions from our crew? Oh, we might be done a little early today. All right. If there's no more questions, which I don't think there are, you wait. We're going to continue on and there will be a question. All right. So last thing, I put the survey in the chat if you would like to take it. It takes less than 2 minutes to do that. And then finally, so tune into our future events on Facebook Live. So we've been through what is Apple Health, you qualify for Apple Health, what's next, and how to approach problems and who to contact. Our next one will be March 24th, renewing coverage. And then our last one will be April 7th, qualified health plans and COFA Islander programs. And after that, we'll go back into person and see everybody out in public, which will be fun. So please let us know. Or, yeah, please let us know if there's any more questions in the meantime. You can give us a call if you have any questions. Other than that, thank you everybody for tuning in, and make sure that you tune in again next time. Awesome. All right, any parting words before we leave, team? How about Claire? Claire, you got a parting word for us? You're on mute.
I keep forgetting that I'm muted. No, just to let the community know that, you know, this live stream that we do, a lot of information, to please tune in. Thank you all.
All right. Thank you, everybody. We'll see you March 24th.
All right. Sizos Maasi.
Thank you.
Kumakain.
Bye. Wala na.